Mr. Gallegos, we'll hear from you now. Please proceed.
Chair Cantu, commissioners, ladies and gentlemen, good afternoon. Thank you for the invitation to participate in this briefing. I refer you to my written testimony, which provides background to the issues that I will highlight here. The federal and local response, both in Puerto Rico and Houston, failed people with disabilities with deadly consequences. People with disabilities were not included in emergency planning and were excluded from accessing much of the disaster relief provided in their aftermath. In addition, there was a notable disparate federal response to Hurricane Maria as compared to the federal response to Hurricane Harvey. Since the Post-Katrina Emergency Management Reform Act of 2006 required the National Council on Disability and FEMA to work close with each other to improve the outcomes of persons with disabilities before, during, and after major disasters, NCD has served as a liaison with the disability community and FEMA. My comments here are informed by meetings and discussions with the disabilities community. In fact, in May 2018, the National Council on Disability went to Houston to hear firsthand from the disability community. And we went to Puerto Rico in May 2019 to do the same. While today's briefing focuses on discrete aspects of FEMA's response to these natural disasters, as it pertains to Puerto Rico, I think it's important that we understand the plight of people with disabilities residing on the island before September 2017. Now, that's important to better understand why they were so vulnerable to the effects of the hurricane and why greater efforts to address their needs and recovery was required. Look, we're talking about the needs of approximately 687,000 people, representing 21.7% of the island's population. People with disabilities were vulnerable to the effects of the hurricane, which was very predictable given the shaky infrastructure supporting their needs prior to the hurricane. Please note that their vulnerability was not predictable because of the existence of their disabilities, rather because of the environmental, societal, and political infrastructure of the island. There was significant economic vulnerability given the island's economic condition and its disparate treatment in federal benefit programs. The island's economic posture was bleak. It filed for the equivalent of federal bankruptcy protection in May 2017. More than 45% of the island's population lived below the federal poverty level. That's more than 3 times the US national poverty rate. In 2017, the poverty rate was 48% among working age people with disabilities. Residents in Puerto Rico are ineligible for the Supplemental Security Income SSI program, arguably the single most important safety net program for people with disabilities in the United States. Instead, they receive benefits under its predecessor program, the Aid to the Aged, Blind, and Disabled program, AABD. AABD, however, is not a substitute for SSI. It provides significantly lower benefits. Today, the maximum monthly SSI benefit is $741 compared to $75 under AABD. Moreover, there was significant food insecurity. The Supplemental Nutrition Assistance Program, SNAP, is available in all 50 states, DC, Guam, and the Virgin Islands, but not in Puerto Rico. Instead, Puerto Rico receives a block grant to fund its own nutritional assistance program, NAP. SNAP benefits are larger than NAP benefits. The criteria to qualify for SNAP are lower than that of NAP. The healthcare system also faced challenges, mainly because it was underfunded. Unlike the 50 states in DC, Medicaid spending in Puerto Rico has been subject to a statutory annual cap. The scope of the island's Medicaid program itself was severely limited. It does not cover home health services, hospice services, medical equipment and supplies, or nursing facility services. All of the foregoing contributed to a low degree of resiliency in the ability of Puerto Rican residents with disabilities to respond to the effects of the hurricane. Thus, when Puerto Rico was hit by Hurricane Maria, the effects were magnified for its residents with disabilities. As reported by the Puerto Rico Disability Community Relief Network, there was only one fully accessible centralized shelter for people with disabilities. Schools used for shelters in the 78 municipalities were physically accessible. They had a ramp for wheelchair access, but did not have accessible sleeping areas. accessible showers, medical assistance, medical supplies, alternate power, or sign language interpreters. None were equipped to address the needs of persons with intellectual or developmental disabilities. As reported by the Partnership for Inclusive Disaster Strategies in its May 2018 After Action report, people with disabilities were turned away from both general and special needs shelters. Among the reasons included power dependence, the need for personal assistance services, service animals, mental health conditions, and the need for support due to cognitive or intellectual disabilities. And disaster survivors with disabilities also did not have equal access to the FEMA application process. In closing, by failing to ensure access to the disaster relief services, FEMA violated the rights guaranteed to individuals with disabilities under the federal non-discrimination laws. That was clearly noted on October 25, 2017, when the U.S. House of Representatives Committee on Homeland Security wrote to the Homeland Security's acting secretary and FEMA's acting administrator, requesting answers as to why the civil rights of people with disabilities were not protected during the response to Hurricane Maria. The letter accused both of playing hot potato with their responsibilities to protect the civil rights of disaster survivors, pointing out that people with disabilities were paying the price. The exact price is unknown. According to the 2018 George Washington University study, Hurricane Maria resulted in the death of 2,975 people. How many were people with disabilities is not exactly known. Disability is not a mortality data point captured in the United States or in Puerto Rico. Thank you again for the opportunity to brief the commission.
Thank you, Chair Gallegos. Our third panelist, Nicole Roy, would you please proceed?